All right, we have some breaking news here. We have a report. Let me make this clear. We have a report that former President Bill Clinton has been hospitalized in New York City at the Columbia Presbyterian Hospital. We have a reporter on the way to confirm it. We'll bring that to you as soon as we can, as soon as we can confirm that. Again, former President Bill Clinton has been hospitalized. It's a report that we've been receiving, and we will confirm as we can. Now, we have Dr. Stephen Garner on the phone. He's a radiologist. Sir, thank you for joining us.
Hi, how are you?
Okay, can you tell us, do you have the history of Clinton, some of the procedures he's had?
Right, we know he had a bypass, which actually involved surgery, going in and taking a vein from the calf and bypassing a clotted area. So if you were doing plumbing, you had a clot in the middle, you just bypass that clot and the blood flows normally and the heart, recovers. That happened a while ago. Now, the fact that he had that shows that his vessels probably had disease to begin with. And this is just a progression of that disease involving another part of the heart, another vessel. Instead of doing no open heart surgery here, what they do is they place a catheter through the groin into a vein in the groin or an artery in the groin. They go all the way up to the heart, and they find a vessel that has this area of stenosis or narrowing. They balloon it, something called angioplasty. They actually go in and blow up the balloons, and the vessel dilates. To prevent it from reclotting, they put a metallic stent in place, a mesh stent, which then holds the wall open so that as time goes on, this will be less likely to close again.
Doctor,
yes.
Let me ask you, do you know when he had that stent put in?
He had the bypass several years ago. I don't recall. It was maybe 5 years ago, 6 years ago.
Okay. Now, the stent that they put in, there was some controversy. If I recall, some stents had medication. There was some medicine that was delivered via stent. Do we know?
Exactly. It's called drug-eluting stents, and that's what most people are using today because they put out material that prevents the stent from clotting. Because you can imagine if it's sitting there and the blood starts to clot, it's going to block up again. What this drug-eluting stent does is it puts out these anti-clotting factors that prevent the blood from clotting in the stent. And that works for a few weeks. At some time there were controversies about their use, but now it's pretty well accepted that this is the way to go.
Now, do we know, first of all, how many arteries were bypassed with these stents? Is it single bypass, double, triple, quad? Do we know?
They could do single bypass. They could do one or two, but these are separate arteries that are involved. I don't recall on the bypass how many vessels were clotted, but there were several, which then again leads us to believe that if there were several vessels involved then, that this is probably a vessel that had disease then that has progressed. I know he's changed his lifestyle. He's not going into McDonald's as much. He's working out. But sometimes due to genetics, there's not much you can do about it, and this is what's happening. This, though, probably experienced some chest pain, went into the hospital, they did an angiogram, and found an area of narrowing, which led to this. So I don't think that he's had a full-fledged heart attack, but this is something that will prevent the heart attack.
Right. Yeah. Now, Doctor, you mentioned he goes to McDonald's less than he used to. We noticed he slimmed down since he was president. He's 63 years old. He spent a lot of time in Haiti. Is it possible all that stress at that age may be at least a contributing factor to a relapse?
Absolutely. Stress is one of the main factors that causes the blood to clot. It makes the platelets cause the blood to clot more. So that stress on top of a vessel that's already compromised could do it. And that's probably what could have tipped it, where it was bothering. It would only bother him if he were under a lot of stress. That if he were at rest or not under stress, that he wouldn't feel any pain. And my guess is he's been feeling pain for several days, and now he's gone in to have it checked out.
Now, would his time spent in Haiti have any effect on it? Is there anything that he may have, I don't know, picked up while he was there?
You mean from an infectious point? I mean, it's always possible to pick up an infection. Usually it's a GI tract thing that you pick up over there. This is something that I believe was there just waiting to cause a problem. And when we were talking about Haiti, the stress of being there could have tipped it, could have been the straw that caused him to have symptoms, to have the chest pain. Because even if an artery is blocked, if you don't put it under a lot of stress, you may not have pain. It's when you stress it and cause it to work harder, have more blood necessary to get to that part of the heart, that you would see a problem.
And what about the travel part of it? I mean, I assume if you're making a lot of flights overseas, you're going up, you're going down in airplanes, changing pressure, will that have an effect?
That also contributes to the stress. But let's not say that wouldn't cause someone with normal arteries to have this problem. So this is something that's added onto somebody who we know has a history of heart disease, and you can't undo by stopping to go to McDonald's now and by, losing weight, it's not going to undo the years of what was done before you did all this. So I think that this is what we're dealing with.
Well, they say that the lung will regenerate. It'll actually kind of fix itself if you quit smoking. First of all, is that right?
Once you have plaque there, the plaque is not going away. And that plaque that's there that's causing the narrowing may continue to grow even if you do change your lifestyle completely, depending upon how bad it was. So if you had plaque 5 years ago and you change your lifestyle, you could still get an enlargement of that plaque. And all these medications, like the statins that you take to try and keep cholesterol down, not going to undo that plaque.
Now, are we under the assumption that once you have a stent put in, you'll have to continue to be medicated? I think some of the blood thinners, Coumadin,
after you're on a medication, Plavix or a blood thinner must be there because the stent is always going to be at risk to clot. So that's something that's going to have to be followed frequently, and you're going to be on blood thinners, which have complications in themselves. Then if you have a fall and you hit your head, you have to worry that you might have bleeding inside the brain, for example. But we have so many people on Plavix and getting this treatment that live normal lives and actually do very well.
Doctor, we have a report, ABC reporting, that Hillary Clinton was seen leaving the Capitol, but not necessarily in a rush. Could we assume that may be a possible good sign?
That is a good sign, and if things would go according to expectations, there would be an angiogram showing a narrowing, an angioplasty done, and then a stent put in. And again, people do very well. They're not put under anesthesia for the surgery. They're giving a little sedation. They can talk. And it's done so frequently that it's becoming almost a routine.
Now, Doctor, if I recall correctly, I think former Vice President Dick Cheney had a similar, symptoms that you described earlier. Made it to a hospital, but did he also have stents put in?
I don't recall. If he had an angiogram, an angioplasty, then he had stents put in. So he would have either had open heart surgery, which I don't recall that he had, so that somebody would have an angiogram, an angioplasty would definitely have a stent put in.
So, Doctor, tell us, if he's had these stents and he's had, bypass via stent, and then he has a relapse, would that necessarily mean that he's going to have open heart surgery next?
No, they can sometimes clean out the stent and clean that out. If they can't, then you go for bypass afterwards. But hopefully you can get in and clean it out.
And what would that entail?
Again, the same angiogram. You need to go up through into the vessel of the heart that's affected, and then actually rotor-rooter, put something in and trying to rotor-rooter it out so you can clean it out.
Well, give us an idea the extent of full-blown open heart surgery, what he may face.
Well, if he had to go for full-blown open heart surgery, that's being put in under anesthesia. It's having the heart either beating or put on a heart-lung machine. And there are complications with that. You can open up the chest, which has complications in itself, which is very painful. And people have had experiences with brain changes and so on from undergoing the surgery with the heart on the heart pump machine. So that is quite a substantial surgery. Again, the mortality is still low. We're talking in the 1% to 2% range. So it's a much more extensive recovery, and it's a more painful procedure. That if you can clear it with a stent, that's almost painless type procedure, and it's a gratifying surgery, and that the people who get it feel better almost instantly. They have more energy and no chest pain. So it's hopefully that he can have it done with the stents.
All right, that's Dr. Stephen Garner. Thank you.